threshold, the membrane potential gets to negative 55. The voltage gated sodium channels open up because of those two gating mechanisms that we talked about. Sodium now rushes into the cell according to its ECDF. The cell is said to be depolarized here. And now this actually creates an event which is a positive feedback loop, because when we open up one sodium channel, we actually create this effect where more sodium channels open up along the way. So opening up of one sodium channel, sodium rushes in, and the presence of that sodium triggers other sodium channels to open up. And so that's where we get further and further away from our set point value, and that makes this a positive feedback loop, okay? And then we overshoot the membrane potential, overshoot in the sense that we get more positive than the rest until we get to positive 30. So we are really approaching the equilibrium potential for sodium, which is what value? Not positive 30, a little bit higher. Positive 60, right? So positive 60 is sodium's equilibrium potential, and that's what we're approaching. But because of the fact that the voltage gated channels are triggered at positive 30 to close, we do not actually get to that positive 60. So at positive 30, we have two events occurring which seek to repolarize the membrane, because now potassium is moving out of the cell according to its driving force. So at positive 30, the inactivation gates close on sodium, the potassium channels open. This is a turn of events here at the peak of this graph, where we now begin to repolarize the membrane potential. And now the movement of potassium can be said to be a negative feedback loop, because we're now reapproaching our set point of negative 70 millivolts. Okay. Okay, so let's kind of use this slide to describe this graph down here. So this is comparing the movement of our two ions. Like you can look at this action potential. We can look at the events of the action potential from different perspectives. So we can look at the membrane potential, but we can also look at the movement of our ions and the channels, right? So here we can see that sodium is moving according to this upstroke of the action potential. And then potassium is moving according to the downstroke of the action potential. And we can also see where the inactivation gates close. This is here. And at that same point, we can see that same point in the graph, after 1 millisecond, the potassium channels open and we have the repolarization of the membrane. Okay. Now going on further, we see that both sodium and potassium channels close, and this is where we get back to rest. Now remember, this is only those voltage gated channels. Remember, the leak channels are always open and always moving ions. Okay, so this is another way to look at this here again. So we're looking at the fact that we have a negative change here. So this is taking us back to our set point from positive 30 down to negative 70. Whereas the movement of sodium is depolarizing and taking us away from our set point. So from negative 70 all the way up to positive 30, okay? And on the right here is another way of showing this, right? The movement of sodium is the upstroke, and the movement of potassium is the downstroke here. And we'll talk about this hyperpolarization event a few slides down. So the membrane potential doesn't go right back to 70, it actually goes a little bit more negative. And we'll talk about why that is. And how we get back to rest from this hyperpolarized state. Okay, so yet another way of looking at this, or another perspective of looking at these events, is looking at the membrane permeability. So what did we say the membrane permeability was? What was a simpler way of saying that? So we said simply the movement of that ion, right? So when we speak about the membrane permeability, we start off at rest with a higher potassium permeability than sodium permeability. We know this is true because we've got more of those leak channels open than we do those leak sodium channels open. Okay, more leak potassium channels than leak sodium channels. And so the membrane potential is close to the equilibrium potential for potassium, which is really negative, right, way down here, and really far from the equilibrium potential for sodium, which we know to be really positive at positive 30. So this is where we start in the resting state. From there, we have graded potentials that get us the threshold. And graded potentials means that we are having small depolarizing events that can get to that negative 55. When they do get to negative 55, we have rapid opening of sodium channels, so the membrane permeability for sodium increases. And you can see these two permeability graphs here, right? This is the sodium permeability rapidly increasing, and then rapidly decreasing as the inactivation gates close. And then we see that the potassium permeability is slowly increasing after that 1 millisecond, and then again slowly decreasing as we get further down. Okay. So another way to look at this is looking at the permeability of the ions, and that is simply saying whether or not that channel is opened or closed, and whether or not the ions are moving. Okay, so at the end here we have the sodium channels closing, the potassium channels opening. Now potassium still moves. This is where we get that hyperpolarization from. So as potassium still moves because of the fact that its channels are still open, potassium is leaving the cell, it's positively charged, and it's going to actually go lower than the resting membrane potential. So we actually go as low as about negative 85 in terms of the membrane potential value, and then those voltage gated potassium channels close. Remember, they're voltage gated, so they're doing a different thing at a different voltage. And the further away we get from rest, then we sort of trigger those potassium channels to no longer be opened, but to close. And so we don't actually get to the equilibrium potential for potassium. Okay, we get to about negative 85. And then the sodium potassium pump, right? Remember this structure? The sodium potassium pump, which is pumping sodium out and potassium in, that kicks in and that helps to restore our membrane potential back to negative 70. So that excess potassium that was stored inside the cell, or the excess potassium that was leaving, rather, to create that extra negative environment, is now pumped back into the cell, and that kind of brings the resting membrane potential back to negative 70. Okay. All right. Now, after hyperpolarization, so this is where we spoke about that overshooting the membrane potential. So we've got potassium channels open, this yellow line representing that. And because they stay opened beyond negative 70, the membrane potential gets more negative down here. And then at this point, the sodium potassium pumps quickly kick in and they reestablish the membrane potential back to our baseline of 70. So there are two things that are helping to get us back to negative 70. The potassium movement via those voltage gated potassium channels, as well as the sodium potassium.